Well, welcome to today's talk. I'm delighted you've come back. The focus of today's video is on infection and transmission of the infection. And we're going to be looking at that through the lens of the Homeland Security Agency in the United States. So that's the main thing this video is about. But before we do that, I just want to do a bit of a snapshot of where we are at in this second wave, which I think basically most people are calling it now. And we see the first wave here in Europe, over here. Looks really quite small in comparison. Now, of course, cases here were greatly underdiagnosed due to limited testing. And we see dramatic effects from the restrictive measures taken in Italy, Czech Republic, United Kingdom, Spain, France, just to give some examples. So, do restrictive lockdown measures work? Well, don't ask me. Look at this graph. You answer the question. To me, clearly they are being very effective. So comparing that to the situation in the Americas. So this is per capita, adjusted for cases. Canada, the direction is up, and I hope you caught that talk with pharmacist Lindsay the other day. If not, do catch up on that. United Kingdom, there's no question cases are going down. Now the United States, it does appear to be going down there, but I've actually looked at the data from the United States just half an hour ago, and that is artifactual. The cases are actually still going up on the United States if you look at the CDC official data. So it is concerning, and I think just before I go into the detail of this video, we're going to look at the Homeland Security data in a minute, but I think we'll just look at why this is really, well, it's becoming, I don't want to be alarmist, but this is becoming a bit alarming. This is the hospitalization data from the States. Now, we know this downward trend is always artifactual. That's the week ending the 21st of November. The data is not complete. But for the week ending the 14th of November, yeah, that one's the 21st, that one's the 14th, that's right. We can see that the numbers of hospitalised patients are higher than they were during the first wave for those different age groups. So we can see the hospital system in the States is coming under really quite significant strain. So it's a good time to review the situation on infection. And so let's do that. Now, this is from the Homeland Security Agency in the United States, and it's good. It summarises the current state of knowledge where we are at the end of November in this pandemic. And these are things we've and ahed about, well, for a long time on this channel now, and things are becoming clearer. And not only are things becoming clearer, what we don't know is becoming clearer. We're more aware of more precisely what we don't know, where further research is obviously always going to be needed. Check on the reference for yourself, it's all there. That was the hospitalisations reference. Now, in terms of infection, this is from the Homeland Security. Human infective dose of SARS coronavirus 2 is unknown by all exposure routes. So the precise number is not known. However, based on human exposures to other coronaviruses and animal exposures. So a lot of experimental work has been done infecting other animals with SARS coronavirus 2. Some animals it's quite easy to infect, mink for example. Other animals, domestic dogs for example, it's much harder to infect. So they've done quite a lot of work on that. I'm not going to go through the data on that, but it is on that site there if you're interested in that. The exposure dose at which 50% of humans become infected. So for any one person, the amount of viral particles it's going to take to become infected is going to vary person to person. So what they do is say how many viral particles would infect 50% of a population. That's the way this is worked out. And the answer is, the answer seems to be 10 to 1,000. Now, they express this as plaque-forming units. And plaque-forming units is actually a proxy for the number of viral particles. Now, what happens is you get the virus, and you dilute it many times, and then you put this this solution containing diluted viral particles, probably now only down to about 10 viral particles. You put that on a cell culture, because remember, viruses are hard to work with because they'll only grow in cell cultures. So very often it's something like chicken, egg, embryo cells that they'll put it on. And every time it depends on the virus actually. For this virus they'll be using something else. I'm not quite sure what they're using for this. But for every time there's a plaque on the Petri dish, that means there's a virus there. So this is the way of counting it. And that turns the viruses from being microscopic, and because it affects surrounding cells, there's something you can actually see on the plaque. So what you actually end up with is kind of, you'll end up with your Petri dish like this with your cell culture on it. And each virus should probably form a plaque, and it becomes clear as the virus kills the cells. And then you can work back, because you know how much you've concentrated your solution, you can work back to the original infective dose. Anyway, that's a bit of a by-the-by. Plaque-forming units. So just basically it's a proxy for viral numbers. It's counting viable viral numbers. So is it 10, is it 1,000? It's somewhere between those for 50% of the population. That's how infectious it is. So it could well be that some people are infected with just 10 viral particles. It's really quite an infectious disease. It doesn't take a lot to start the disease off in someone new. UK human exposure trials are scheduled for January 2021 in the United Kingdom. Then we'll know. As of now, officially in the world, no human exposure trials have officially taken place. If they have, the relevant governments are keeping very quiet about it, but they are. It's going to officially take place in January in the UK, and that's been sanctioned by government. Now, one thing I wanted to mention here was golden Syrian hamsters. It's the only animal study I'm going to mention. It looks like they get infected with 56,000 plaque-forming units. So you can see that the hamsters are not as prone to SARS coronavirus 2 as humans, because they need more viral particles, and of course they're much smaller animals. But the reason I've put this in is when they are immunosuppressed, when their immune systems are not working right, they need about a fifth, the 100 to 10,000 viral particles, so massively less, a fifth to a 50th of the viral particles are needed. And I think this applies to humans as well, because if humans are immunosuppressed, they're much more likely to contract the virus. And we know this with people that are overtly immunosuppressed, but lack of vitamin D will lead to a form of immunosuppression as well. So I thought that was interesting, that the state of the immune system is critical here. At least it is in hamsters, and it's reasonable to assume that it is in humans as well. Now, what we need to know on this, what we don't know, human infectious dose, by aerosol, by surface contact, that's the fomites, and by fecal-oral routes as well, because we know this can be excreted in feces. So, and other potential routes of exposure. So these are things we don't really know in quantitative terms, but these UK studies should be finding that out. We're not sure what the most appropriate animal models are. That's being worked on as well. And does exposure determine disease severity is actually a question. We believe strongly that it does. I strongly suspect these human infection studies will show that it does. That's why we wear masks, to reduce, well, one of the reasons, to reduce viral load. But we don't have a definitive scientific answer to that question yet, according to the Department of Homeland Security. Now, moving on to transmission. Exhaled breath may emit genome copies. Again, that's basically means viral particles. So an infected person is going to excrete 10 to the 5 to 10 to the 7. So that's 100,000 to 10 million viral particles per hour. So that's how many viral particles a person will be breathing out per hour. And what was the dose of virus that we needed to get infected? Well, we believe that's 10 to 1,000 copies of the virus to cause a new infection. So 10 to 1,000 viral particles should do the job. And an infected person is breathing out 100,000 to 10 million. And of course, this explains why we have a pandemic. Droplets are large droplets. Aerosols are smaller droplets that can spread further than 2 meters or 6 feet. And fomites as well can also cause the infection. Now, what do they mean by close contact? Can you see if people are breathing that number of viral particles out per hour, then the longer someone's in contact, the higher the viral dose that they're going to get. And close contact is defined as 15 minutes within a 24-hour period, less than 2 meters or 6 feet apart. But aerosols can travel further. The scientific evidence for this is not definitive, but it's accepted by the Centers for Disease Control now. And we've known about it on this channel for many months now. So it's a combination of time. You can add the time up to make a high risk of infection. Now, people are infectious for 1 to 3 days prior to symptom onset. So this is fairly definitive now. 1 to 3 days prior to day 1, people are infectious. And 40% of infections in the United States have been transmitted via people that are in this pre-symptomatic phase. In the United States, in fact it's more than the United States, this is based on international data. Asymptomatic people, now true asymptomatics aren't that common, it's probably only about 20% of people. Others get minimal symptoms, but they only account for 12% of new cases. So we can see that the main reason this pandemic has spread is that people are infectious before they get symptoms. This is why we have a pandemic. 5 days after symptom onset, people are also infectious. So we have 5 days after symptom onset and 3 days before. So that's 5. So people are infectious for 6, 7 or 8 days when they have the infection. Quite a long time. Asymptomatic individuals can transmit disease as soon as 2 days after they've been first infected, because the incubation period varies. So that's quite a short period of time, really. Asymptomatic children may have substantially lower levels of virus in the upper respiratory tract than symptomatic children. So it looks like asymptomatic children are excreting or breathing out relatively low viral numbers. So that's remarkably good news. In the United States, symptomatic index cases result in transmission to approximately 53% of household members. So what this is saying is, based on US data, if a person in the household developed COVID disease, SARS coronavirus 2 infection, on average over the United States, 53% of the members of their household would also become infected with the virus. SARS coronavirus 2 may be spread by conversation and exhalation. They confirm, again we've known this for a while. Most transmission is indoors, in offices, restaurants, bars and gyms. And the thing that's still not being done right, that the British government finally woke up to in the past few days, of course we looked at this yesterday, we are not ventilating enough. I know it's cold, but intelligence can be usefully defined as the ability to adapt to new situations, work the problem, work out what to do about it, send your kids to school in extra woolly jumpers, do whatever it takes to get that viral load down. Each bit of fresh air from outside is diluting any viral load inside, and we know that this has been a major cause of spread. Clusters are often associated with indoor gatherings. We've seen this many times. Undetected cases play a major role in transmission. As we know, we're only picking up very small numbers of cases. So from memory, the official American data now, the US data for example, I think it's just over 13 million officially diagnosed cases. But we did see yesterday that the Centers for Disease Control has said that actually probably 53 million people in the United States have been infected. So the actual official numbers are only picking up a very small proportion of the total number of infected patients or people. So most cases aren't being reported. Individuals who have clinical recovery but test positive for COVID-19 are unlikely to be infectious. Again, we did this when it first came out. Some people were testing positive for long periods of time, but it turned out to be viral fragments and they were not viable. They couldn't cause infection, and that was demonstrated epidemiologically, because these people who were still testing positive for the virus 2, 3, 4 weeks later never infected anyone else. So individuals have recovered but test positive are unlikely. So you can never say never, but it's most likely that there's no viable virus after the first part of the illness, and that any positive tests are caused by viral fragments. And this is exactly what we see on the East Virginia Medical School. Viral debris can be detected, but after here the person would no longer be infectious. They would no longer be spreading the disease. So again, good to confirm what we've suspected for a long time. What we need to know, what we don't know, in other words, we don't yet know. Relative contributions of different routes of infection, fomites, aerosols, droplets, how these work together. How common is transmission from body fluids like semen, urine and feces? Well, I'm not too worried about genital fluids, to be quite honest, because I think the closeness there would be much more likely to cause droplet infection anyway. But the urine and the feces, the fecal-oral routes, that's got pretty big implications for things like sewage workers, for example. And we don't know. We don't really know that one. As well as that, could wildlife come into contact with our sewage? And could the virus get into wildlife as a result of exposure to urine and feces? Interesting questions, and the Department of Homeland Security doesn't know the answer. And if they don't, I certainly don't. More questions that need definitive answers. How infection are young children compared to adults? It looks less, but it's not definitive yet. What is the emission rate of infectious SARS coronavirus 2 particles while breathing, talking, coughing, singing and exercising? Well, basically we know it goes up with these, but again they want a quantification of that. Taking into account viral load in the upper and lower respiratory tract. And this is the other thing that it comes out through what they're saying that is not as clear as we would like it to be, is the differentiation between upper respiratory tract infection and lower respiratory tract infection. We believe the lower respiratory tract infection is likely to make us more sick, but what are the implications of that for disease transmission? So that is the current state of knowledge. That is where we are at. And the department, do click on this. Do click on this from the Department of Homeland Security. That which camera am I on? That link there. Do click on that, because it's got an awful lot of information and literally hundreds of references. If this was an annotated bibliography that one of my students had written at master's level, I will give it an A+. It's a very, very tidy, parsimonious piece of work. Now, just to finish, I wonder if we can, I'll just go onto the second screen and see if we can see Kevin from Bangkok. These are people going into the supermarket in Bangkok, and they have to look into this thing here. Hi, Kevin. And it will only let you in. So that screen there does two things. What that screen does is it takes your temperature, and it makes sure that the mask is covering your mouth and your nose at the same time. So I thought that was quite clever. Kevin writes, I am extremely lucky to live in a country that took the pandemic seriously and took action immediately. So Kevin greatly appreciating the response of the Thai authorities. We did and ah about this back in February, March, and we weren't sure about the accuracy of the information, but it was accurate. The Thais did a really, really good job earlier on, so my apologies for daring to question the integrity of the Thai authorities. They were right, and my scepticism was wrong. Our lives are pretty much back to normal for months now, but with masks, which are already popular in Asian culture anyway, that's true. I hope the whole world can enjoy the same freedoms without fear of getting infected or infecting someone else. I hope the vaccines are the solution and that 2021 will bring an end to the pandemic. I think you're right, Kevin. But in the meantime, we just applaud the job that the Thai authorities have done. And we see that even although there doesn't seem to be any community transmission at all in Thailand now, they are still taking these protective measures. Now, talking about protective measures, I think I'll just mention the BBC reported, was on the news yesterday. Apparently, the population in Northern Europe and England is deficient in vitamin D. And they even think now on the BBC that this might predispose people to respiratory infections, possibly even COVID-19. And this is the trumpeting this is as if it's a big thing they talked about. We did mention it in January, by the way, of course. But anyway, as a result of this, what's happening? Now, Matt Hancock, the Secretary of Health, I mean, it's just, isn't it appalling how we've been let down by mainstream media? You know, the BBC is just starting to talk about vitamin D. And I was talking about it in principle in January, just from things that we've known for a while. And the evidence was getting pretty good by March, April. We looked at this and now in the end of November, we're nearly into December, and the BBC are thinking, oh, it's pathetic. Anyway, now it looks like in Scotland, vulnerable people are getting 10 micrograms of vitamin D. Now, 10 micrograms, I think that's, what's that? It's 25 micrograms is equal to 1,000 international units. So that's about 400 international units, I think. Remarkably small dose. So Public Health England are currently advising 10 micrograms of vitamin D for everyone between October and March. I agree with that. I think everyone should be taking that as per the guidelines. I also think I have submitted evidence that shows that is a ridiculously small dose for most people. So vitamin D is being given away from January to April by the British governments to all care homes in England because of the incredible sacrifice made by the British people to control the virus. Many of us have spent more time indoors this year and could not benefit. So we haven't made enough vitamin D because we're inside. So that's true. Vulnerable individuals access a free supply to last them throughout the darker winter months. Good. This will support their general health, keep their bones, muscles healthy. Okay, all good. Okay. But you see, I think Matt Hancock's understanding here because he's talking about keeping their bones and muscles healthy. Okay, there's some intimation there that it supports immunity, but you know, he's still kind of old-fashioned, the idea that vitamin D is necessary to suppress rickets, which of course it is. But we also know it's now a vital immunological molecule. As far as we know, all the cells of the immune system contain vitamin D receptors. Let's look a couple of pictures, and let's have what's this one? By the way, thank you. Many of you are sending pictures in now that illustrate the pandemic and help us to document it. This one is from Kathy in Buckinghamshire, in rural England. Keep out if we get C19, no one to see to the to sheep. What a good point. So that does kind of illustrate an aspect of the pandemic to me. So thank you for that, Kathy from Buckinghamshire. I've got many more photos I'm actually processing, so do keep sending them in. Now this is from Mary in Old Sussex. I'm not sure what the difference is between Sussex and Old Sussex, but and that is really quite a powerful photo, isn't it? Quite a powerful picture there. That speaks volumes. Because we have the path that people normally walk on, And this path wasn't here last year in 2019. This path has been caused by people walking on this path. What is now a path to avoid people walking on the official path. Therefore, a person is there, another person is there. So the social distancing has been maintained. What a great example, Mary. That really does illustrate quite a lot about this pandemic. And the last picture I'm going to show today is the latest Swiss cheese model. Just love cheese of any sort. Tend to eat Swiss cheese for breakfast, if anything. It's kind of a lighter cheese, isn't it? But here's the model. Swiss cheese respiratory virus pandemic defense. So here's the virus. Here's the individual. Any one thing is going to let a few viruses through. So we have lots of slices of Swiss cheese so the holes don't line up. So I like that. And you can see them here, so the person stays green. Personal responsibilities, shared responsibilities, so physical distancing, stay at home if sick, masks, hand hygiene, cough etiquette, avoid touching your face, if crowded limit your time or certainly wear a mask, fast and sensitive testing, ventilation, glad to see the ventilation one is there, air filtration, government messages and financial support, quarantine and isolation, vaccines. No one thing does it all. It is a combined approach. And if someone is writing these Swiss cheese models, please put in a slice of Swiss cheese for vitamin D as well. Okay, so clearly things we now know, things we don't know, we're learning as we go along. I think again, we try and look for good things that are coming from the pandemic, and that is that people are, when I say people, I mean humanity in general, scientists, epidemiologists, virologists are actually learning a lot from this pandemic. And this could, the knowledge we're getting now could potentially save us from the next pandemic, which could have a case fatality rate of 50%. So this could be to the long-term benefit of millions and billions of people potentially, because remember, we are lucky that SARS coronavirus 2, although it's a dangerous virus, we never underestimate it, but its case fatality rate, the infection fatality rate, is relatively low compared to Middle East respiratory syndrome, compared to Ebola, compared to other viruses, smallpox, and many other viruses that have caused pandemics in the past. The next pandemic could be a more aggressive virus, and we're learning lots of good stuff. So that is maybe just a positive to take away. Thank you for watching, as always.